first presenter is Matthew Bennett, medical student at LSU, and he's class of 2023. He'll be presenting a poster titled Efficacy and Safety of Spinal Cord Stimulators in Military Veterans.
So thank you for the introduction. Sorry for the technical difficulties.
Great.
My name is Matthew Bennett, second year medical student at LSU in New Orleans, and I'm going to be presenting the 10-year review of efficacy and safety of spinal cord stimulators in military veterans. I worked on this project with Dr. Casey Murphy, Dr. Randy Roig, Dr. Justin Doty, and medical student Bradley Trimble. So as we're all aware, spinal cord stimulation has been shown to be an increasingly safe and effective treatment option to treat patients with chronic intractable pain. However, most studies out there have been designed to analyze the stimulator's impact on the general population as a whole. Effects on the veteran population specifically remains unknown, and with this population having been shown to experience significantly higher rates of both chronic pain as well as back pain, it was important for us to demonstrate the fact that spinal cord stimulator provides similar effects to this population. So to answer our question, we conducted a single center retrospective review of spinal cord stimulator patients treated at the New Orleans VA from 2008 through 2020. 65 out of the 76 eligible patients agreed to participate, and participants completed a brief survey on their past medical history, as well as answered a pain outcome questionnaire by phone. Our primary outcome measure was whether or not veterans would recommend spinal cord stimulators to their peers, to their veteran peers. We went with this as our primary outcome because we believe that it did a pretty good job to encompass both efficacy and safety in one question. Secondary outcomes included improvements in overall pain, ADLs, as well as mental health, all reported on a scale of 0 to 10, as well as ability to decrease opioid intake if applicable. So after conducting our interviews, we found that 77% of veterans would recommend spinal cord stimulators to their peers, 14% would not recommend the stimulator, and 9% were unable to say. For our secondary outcomes, we found significant improvements in 16 out of 18 questions in our pain outcome questionnaire after running a paired samples t-test. The two scores that showed the greatest amount of improvements were overall decrease in pain score, and second was the ability to reduce pain's impact on patient self-esteem and self-worth. We also found a decrease in mean opioid use from 52 morphine milliequivalents per day to 31. In terms of safety, we found 3 patients developed skin dehiscence months following their implant. 2 of these cases were overlying the generator site, 1 was overlying the anchor site. All 3 patients were treated with an explant and suffered no neurological sequelae. And interestingly, all 3 of these patients who underwent that explant were able to undergo another course of spinal cord stimulation, as this was their most successful option in treating their pain to date. So aside from those 3 cases, 18 other patients reported self-reported a minor complication, most of which were minor mechanical malfunctions that were able to be resolved with the help of the device representative with minimal inconvenience to the patient. In conclusion, given our findings, we were able to conclude that spinal cord stimulation is both safe and effective in treating patients with chronic intractable pain in the veteran population. And that's all I have, so I'd like to open it up for questions, if anyone has any.
Thanks, Matt. That's a very interesting report. It looks like patients were pretty well selected and managed appropriately, and satisfaction's, I'd say, pretty high, if not higher than the general population. I'm looking here to see if we have any questions come through. I think with the rapid turnaround we're going to be having, it may be difficult for people to keep up with us. Do you happen to have any information on and forgive me if I've missed it, on the diagnoses that were used here? Were these mostly lumbar people, probably?
Yes, I have those here. Primarily, almost 50% were post-laminectomy syndrome. 25% were chronic low back pain, and we had a few cases of cervical, I believe, spine pain, but it was for the most part PLS.
Be curious to kind of break that down and look and see the satisfaction if that changed with those two sites. Cervical's tougher, in my opinion. Well, thank you very much. I didn't even know what a spinal cord stimulator was when I was your age, so you're way ahead of me.